All right, good afternoon, good evening, everyone, and welcome to this week's edition of Community Conversations, where the community has the opportunity to hear from and ask questions of our foremost public health officials for Sacramento County. My name is Carlos Casio. I'm a health program coordinator in the Division of Public Health. So we'll start with some introductions from the doctors Peter Beilenson and Dr. Olivia Kasirye. And then um, we'll go into a question and answer session where folks will have the opportunity to submit their questions via the chat box on the bottom. If you look at the bottom of your screen, there's a ribbon there where you see a Q&A. That's where you'll hop in and you'll go ahead and type your questions there. And I'll read them aloud, and we'll have the opportunity to hear from Dr. Beilenson and Dr. Kasirye and their thoughts. Before we get started, I'm going to ask Kayla, our Spanish interpreter, to go ahead and just give folks on the call an explanation of how to access the interpretation portion of this meeting.
Buenas tardes, mi nombre es Keila, yo soy la intérprete al español. Si usted ocupa interpretación al español para esta reunión, puede ver un globo en la parte de abajo de su pantalla y si oprime ese globo, le va a dar la opción para escuchar mi interpretación de esta reunión. Gracias.
Awesome. And we also have Cindy and Jordan, who are going to be providing American Sign Language interpretation for folks on the call today as well. So with that, I'm going to turn it over to Drs. Beilenson and Dr. Kasirye for an introduction.
Hi, thanks very much for having us again. We appreciate it. I wanted to take this moment at the beginning just to apologize. For some of you may have heard that while I was testifying in favor of racial disparities being a public health crisis, I said an incorrect word, and I apologize greatly for it. I will make sure that I call the Asian Pacific Islander communities Asian Pacific Islanders in the future, so I apologize for that. On to COVID, we now have 32,000 cases of COVID in Sacramento County. We have about 207 hospitalizations and 50 people in the intensive care unit, which is getting close to our high water mark of about 3 or 4 months ago. The hospitalizations tend to follow cases by about 2 weeks, and deaths follow that by another couple of weeks. And we're seeing the hospitalizations go up 2 weeks or so after the initial cases started going up. The cases have gone up predominantly from nursing homes, long-term care, Halloween parties, and gatherings in general. So we're really focusing on that. I know we're going to take a lot of questions. Let me just jump quickly to Thanksgiving. If there's a single day in the entire calendar that worries me the most, it's Thanksgiving. For obvious reasons, it's the gathering time among almost all cultures in the United States of America. People come from colleges, grandparents come from far away, et cetera, as well as at Christmas and other holiday times. If we can just, for this one Thanksgiving and Christmas time, not gather, but rather gather only with the members of our family who have lived in the same household with us for this year alone, we can really make a big difference in terms of keeping the number of cases down. And the positive note this year is that the vaccine is coming as soon as December. By the summertime, we should have vaccine distributed to virtually anybody who wants in the United States of America, and hopefully a lot of people will want it, and we'll be back at a stage of much more greater normalcy than ever before, than we have been in the last 8 or 9 months. So let's just please keep gatherings down to a bare minimum at this Thanksgiving and holiday season. Thank you.
Good evening, everyone, and thank you again for taking the time to listen to us and also present your questions. What a difference a few weeks make. If you recall, end of October, we were talking about turning Sacramento orange, and we almost hit that. And then things slowed down. And unfortunately, especially 1 week after Thanksgiving, we started seeing a very rapid increase in cases. Now we're back in purple. And just to show you how quickly the numbers have increased, as some of the numbers that Dr. Beilenson has pointed out, but also when you look at the state tier system, we do follow two indicators specifically, and one of them is this case rate. And the number that we got on November 4th from the state was 7.4 per 100,000. So basically we had just gone over the threshold for the purple tier. And then this week, the number in the report was 21 per 100,000, and it is still going up. So, and a lot of that, as Dr. Beilenson has pointed out, could be tracked back to Halloween parties. And so the state has taken a number of steps in addition to many of the counties having to revert back to the purple tier. And you probably are aware that the state issued an advisory guidance for travel, stating that one, they're requesting that you, leave off taking any trips that are not essential. And then the other is that for those that do travel, that when they return to California, that they do need to quarantine for 14 days. And today, the state also made an announcement for counties in the purple tier, and there are 41 of us right now, that there would be a curfew for everybody between 10 p.m. and 5 a.m. And that will be effective on Saturday. And so again, all of these are efforts to try and slow down the spread of COVID-19. As Dr. Beilenson has pointed out, our hospitalization numbers are increasing, and our the deaths will also we'll see an uptick pretty soon here. So we're really trying to stave this and turn things around. And we've done it before, and we know what we need to do. So I think we just need to buckle down and make the sacrifices that we need to make in order to keep everyone safe.
Great, thank you. So we'll transition now into our question and answer portion of the evening. And we'll go ahead and get started with this one. How is the county preparing for vaccine distribution once a vaccine is approved?
There are a couple of steps that we're taking. One is coordinating with the state and coordinating with the surrounding counties, and also coordinating with the hospital system, looking at what kind of resources we will need in terms of staffing and refrigeration, and also working with some of our partners within the county to be able to make sure that we have enough staffing. We do have a plan, and it's based on the information that we have right now and the prioritization, but we would still need to have additional details in terms of when will the release of the vaccine occur, and also what prioritization we need to have in terms of which groups will we start with. We know that we've been given some general guidelines that it will probably be healthcare workers, and then next to that would be people who are most vulnerable, those over 65 in long-term care facilities, and those with chronic diseases. So we do have a plan, but we are awaiting additional information, as well as information on how much vaccine we will get, because that will determine the next steps.
And if I may, I'm not particularly worried about the logistics of giving the vaccine. It will be a much greater number of people that will be needed than we normally have for our flu vaccine, our flu shot clinics. but we're used to giving shots. We're used to giving vaccines. We would flip testing centers to vaccine centers, Cal Expo, Sleep Train Arena, et cetera. I'm quite confident that we'll have the resources to do that and logistics to do that. The thing I'm really worried about is how many people are going to accept the vaccine. Right now, polls around the country show only about 40 to 50% of people will accept the vaccine, and we need at least 70% to have herd immunity and to bring us back to a sense of normalcy. So we're going to have to do a lot of work to get people to be willing to use the vaccine.
Will the alcohol beverage control be tasked to enforce a county ordinance with restaurants with Type 47 liquor licenses?
So is that related to the curfew, or is that related to the enforcement that we're talking about doing? Do we know? Well, I'll talk about it from 2 points of view. Okay. So from the curfew point of view, ABC has the ability to enforce against the alcoholic beverages servers, the bars, et cetera. When we're talking about what we're going to be potentially proposing in the county, which is enforcement of the law of the public health order that Olivia Kasirye has put out, we will probably be using EMD, environmental management, code enforcement, and public health workers, but we will probably not be using ABC for that. We're not sure yet.
Okay. What is the state of contact tracing in Sacramento County?
So in Sacramento now, we do have about 100 staff members that are available that are doing the contact tracing. So we're in a much better place than where we were with the last surge. We also have a software system that we have implemented that can also do the contact tracing. So right now we are in good shape to be able to continue to adequately do the contact investigation and contact tracing.
Okay, great. All right, we have a question here that says, I picked up an order from a restaurant and they had an outdoor dining area, but it was an enclosed tent. How is that any different than just having indoor dining?
So they're not allowed to do that. They have to have no more than one wall in order for it to be outdoors. So if it's covered around by 3 or 4 walls, it's not illegal. It's not legal.
We have been referring those inquiries to our environmental management department, which oversees the restaurants. And right now they're doing education, and we are looking at the guidelines that we have put out to make sure we provide clear guidance for the restaurants to know what kind of structures would be permissible for while we're in the purple tier.
All right, we have a question here that says, why won't the sheriff enforce the curfews and social distancing policy? Matters are being referred to county health. Does county health have the manpower for enforcement?
Good question. We're not 100% sure about the enforcement, particularly of gatherings and people. In addition, there are not very many people that work in public health, not compared to the sheriff's office. So we would really prefer the sheriff to be able to take part in this, but apparently he's not going to do so.
Okay, next question. You have consistently stated that your health orders to protect our county residents from COVID-19 are based on science and data. Why are you not using science and data to protect our county's residents' overall health?
I'm not sure I understand the question.
Maybe perhaps explain how our health orders are based on science and data.
Well, I'll take a quick stab at this, then Olivia, if that's okay. So we've been talking about using the data to judiciously reopen slowly the county and to judiciously restrict the county. And so we would argue that I think what the person's getting at is that, again, the data shows that this is spreading predominantly among Halloween party goers, gatherings, and long-term care folks, not the restaurants, not the gyms, et cetera. And so I think the argument is, why are we closing kind of wholesale everything down instead of allowing like the restaurants to remain open partially with partial capacity and the gyms, et cetera. I think that's what she's talking about. That's what they're talking about. And right now, the state pretty much governs what we can and cannot do. Olivia?
Yes, and also to add on to that, the reason for closing down the businesses is it then reduces the intermingling and interaction of people, and also reduces travel. So when we're able to achieve that, it does in effect also reduce the transmission of COVID-19. So that's the reasoning behind shutting down the businesses. For the private gatherings, it is more of a challenge because many of them are occurring in private homes. And so we don't have a lot of jurisdiction over those private homes unless the neighbors complain because of a nuisance with lights, noise, or traffic.
Okay, so next question would be, many cases are detected in households with multiple members where quarantine becomes difficult. Does the county have resources to help people self-quarantine?
Yes, we started a program a few months ago, and this is in collaboration with several community-based agencies where we have community health workers. So if a contact tracer is talking to somebody and finds out that that person has challenges with being able to isolate or quarantine, then they can transfer or refer that person to a team of community health workers who will then be able to connect that person with the resources to be able to do that. If it requires having a separate hotel room or being able to provide the meals or any other services that that person might need in order to be able to safely quarantine or isolate.
How many cases are centered in elementary schools?
I do not have that number in front of me. In general, we have not had a lot of cases in elementary schools for several reasons. One is that schools have been closed for the most part. And we were just in the process of reopening when we were in the red tier, but now, of course, having reverted back to the purple tier, that is on hold right now.
Okay, so for schools who have returned to in-class learning, is there a possibility of closure? Numbers are spiking and this does not seem safe. Some schools have already had to quarantine due to possible exposure.
Olivia?
Sorry, could you repeat that?
I'll take a stab at it. So if you were when we were in red, if you opened as a school, whether it's hybrid or in person to some extent, you're allowed to remain open if you turn purple. When we turn purple, any school that was not currently working in school has to stay out of school and be online. The issue is, Olivia, that what about schools that were open, and if they have a really bad outbreak, could they be closed down?
Yes, absolutely. So after we reverted to the purple tier, any of the schools that had already opened were able to remain open. But if there is an outbreak, then we are able to close that school.
Okay. In your opinion, had we taken the same approach as Sweden, do you think we would have flattened the COVID curve?
That's very questionable. I'd actually talked about doing what Sweden has done for a while, but then kind of pulled back. For those who don't know, Sweden has basically tried to impose herd immunity by allowing many people, not everybody, but many, to kind of go about their business and get the virus and then recover, many of them, but many of them not recovering, and eventually getting herd immunity. So far, they have a very high death rate, particularly compared to Europe and the Scandinavian countries. And it's still out in the, still to be discovered whether or not it really makes a difference what they've done. I would argue that what we should have done is much more strict testing, quarantining, and taking care of people in a much better way here in the United States. Had we done so, we wouldn't have had to think about doing Sweden.
Okay. Indeed, the worst effects have been borne by the underprivileged. The rest of us don't have the luxury of sending our children to in-person instruction at the prohibitively expensive and exclusive country day school like our fellow county residents, Governor Gavin Newsom and first partner Jennifer Newsom. The rest of us can't afford oversized luxury birthday parties at the French Laundry in Napa like our fellow county residents. Governor Newsom and first partner. Our large Vietnamese population that's suffered under the restrictions on hair salons, nail salons, and restaurants can't afford to rebel against social distancing, indoor dining restrictions, and mask wearing requirements like Governor Newsom and the first partner.
What is the question?
I was expecting the question mark to lead to one, but I apologize. We can think it's a commentary on the impact of the restrictions on these various sectors.
So one of the problems that's occurred in the last several months is that this has shown a much greater inequity than we could potentially have seen before, and the Hmong folks and Asian Pacific Islanders and African Americans and Hispanics and poor white folks have had much greater problems, both in terms of access to care and quality of care and care in timely fashion. And that's been a real wake-up call, if you will, to us. And that's actually one of the reasons that we went for public health disparities being a crisis.
Okay, if someone has had a positive COVID test, do they still need to wear a mask, social distance, etc.? I mean, months after the infection as well.
So there's some things that we are not as clear about or sure about with COVID-19. One of those is whether everybody who gets infected actually becomes immune, and also how long people remain infectious. So we know that in general, people do remain infectious for about 10 days, and that is why we have that as the isolation period. But then we also know that some people do continue to shed the virus. We also don't know that if people have had the COVID-19, if they are immune, and so that they wouldn't be at risk if they got exposed again. Now we know that the risk of reinfection can occur, and so that is why our recommendation is that even though you have had the COVID-19, that you do follow the guidance for face covering.
Okay. If Sacramento County has 32,000 cases, are those active infections, or does that include those who had it and recovered?
It includes those who had it. Oh, sorry, go ahead.
If they have recovered, they should no longer be counted, right?
No, these are people that have had it and do have it now. And they should be counted regardless, because it's actually important to know how many patients have gotten this disease. And it's also important for, in terms of antibodies, whether they have them or not. So we actually have to count everybody, and this counts everybody. We've been counting everyone.
I also want to point out that in public health, we measure different indicators. So we have what we call a cumulative count. So that's what we are showing up on our dashboard. But we also are able to track how many infections we've had in the last 30 days, in the last 7 days. And as I mentioned with the state, when they are looking at the indicators for their tier system, they look at the daily case count over a 7-day period. So it's, and all of those different indicators provide us some information. So yes, it is important for us to have the cumulative count, as well as being able to count how many cases we're getting on a daily basis.
Okay, next question. I would like to know how the Danish mask study and its conclusions that 60 years of other mask studies show no statistical benefit for wearers. How, with this data, do you still believe a mask mandate is beneficial?
So the CDC has done many studies that have shown that it works, not only in terms of preventing you from spreading to others, but from others spreading to you. I think we'll have a decent number of cases of studies that are contradictory, but it's very clear that it certainly is not a danger to wear a mask. And every piece of evidence that we see, at least in the United States, is that mask wearing makes a difference.
Okay, can youth sports conditioning continue to be permitted?
Currently, youth sports is permitted. We are not permitting scrimmages or competitions at this point.
What percentage of severe cases are in elder care facilities?
47%.
Okay, my question is, why can these restaurants be open? I'm so sorry. That was, okay, give me 1 second. I have a planned trip to Cancun, Mexico for February 2021. What should I know when traveling?
I think it's important to follow the CDC guidelines and also the travel guidelines that are provided both in California or locally, as well as for your destination. In some places, they require that you do visit a certain place, that you have to go on quarantine, 14-day quarantine when you arrive. For others, they require that you have a valid test within maybe a 72-hour period prior to arrival. So you need to check what the requirements are before you get on that plane.
Okay, so the next question, I'll go back to it now, is I went to a casino in Sacramento. Everyone did wear a mask. All restaurants are inside and fully open. I did not notice any of the protocols that you put in place for our Sacramento restaurants. So why is it again that our restaurants cannot be open inside? Why are Sacramento restaurants being singled out?
Well, that is, again, at least if that's the way that it's described, that is not an appropriate use of restaurants in the building, nor is it safe. And so again, the number to call is 311. Whether we can enforce fully or not, we can at least come out and see them and read them the Riot Act. And so please call 311. We get about 150 calls a week from these places. And so we do investigate them.
Okay. How long will this latest tier change to purple in your best opinion?
2 months, at least. Olivia?
I think it's hard to estimate. Right now, we are concerned about the rate at which the numbers are rising. And so we're working hard to be able to turn that around. We know that according to the state guidance, we would have to stay in the purple tier for a minimum of 3 weeks. But then we would have to meet the criteria for the red tier. So I think what's important is for us to turn this around so that we can start going in the right direction first.
All right. Can you provide more specifics on the nature of the curfew?
Yeah.
All we have right now is the announcement that was issued today at 3 p.m. And what we know is that for counties in the purple tier, that all businesses need to be closed and everyone needs to be home. And those are for the non-essential businesses need to be closed between 10 p.m. and 5 a.m.
I've got to say that I'm not terribly optimistic that this will make a huge difference. It may make a little bit of difference around the edges of restaurants and the few bars that are open to be able to serve, because they serve food as well. But in terms of what's actually driving our outbreak, again, which is the gatherings and Thanksgiving gatherings and Halloween gatherings and nursing home and long-term care, that 10 to 5 is not going to make a big difference. I mean, there are not a lot of people who go to Thanksgiving feasts at 12 midnight. You know, it's usually 2 p.m. to 6 p.m. So if they want to really do something, I really think they should be focusing more on the businesses that are at the problem.
Okay, and I think this next question gets at when the curfew starts. They're asking, is the curfew set for this Saturday, November 21st?
Yes, that's correct.
Okay. When you refer to gathering, do you include gathering for meals in this definition? I know,
Yes.
I'm sorry?
Yes.
Yes, okay. All right, when and how will you decide which brand of vaccine to use?
That will be determined by the federal and state government, because they will be the ones who will be in charge of the distribution. We don't know when, because of course we know that there are 2 vaccines that are looking very promising, but they still have to get the FDA approval before we can even start talking about dates.
Okay, can the public health department get more current information on the dashboard, such as daily positive and daily negative by zip codes? This information is obtained at the time of testing.
So there are a couple of things to note. I know that we've had a number of people ask about the zip code data, but I think it's important for you all to understand, yes, it is an important indicator that we look at, but actually we use it to see how much testing is being done, or if we need to focus on certain areas for testing. And usually we look at it at the county level as opposed to doing it by zip code, because when you're doing it by zip code, a lot of especially the negative reports that we get have missing information. And so it takes quite a lot of resources to fill in that missing information in order to get it at the zip code level. And especially for the smaller numbers, it's kind of more difficult to interpret. And so I think there's a lot of emphasis that's being put on the positivity by zip code. And I think what we really need to focus on is the cases and case rate, because that does give you actually the information that you need.
Okay, what has the public health department done about areas of Sacramento County that have had high COVID transmission rates?
There are a couple of things that we're doing. One is that when you look at the sites of our community testing, we based those on the number of cases by zip code. And so especially the areas that we considered hotspots is where we looked to place those testing sites. The other also is we looked at disadvantaged communities, communities that didn't have easy access to transportation, to go through the drive-through, or to be able to have easy access to clinics or hospitals. So again, that's one thing that we did. I also mentioned that we have a program with community healthcare workers. And again, that's through collaboration with community-based agencies that serve these communities that have been impacted.
How is the county addressing the increase in depression, suicide, drugs, and alcohol? Can you provide statistics on the rates by race, ethnicity, and age?
We can't provide statistics on that as of yet, but we've been doing a lot of telemedicine, and there's been a huge amount of telemedicine being done, and with much better compliance with meeting times, like 90-something% compared to 70% of when you're regularly out in the world and meeting your therapist or whatever. So there's been relatively good pickup in terms of being able to get treatment. How much treatment is available and what is going on with suicides, et cetera, we don't really know yet until we get data.
I also want to point out, because that's a question we've been asked quite a couple of times, about the suicides and the thought that the number of suicides is down. The data that we have right now does not indicate that there's been an increase in suicides in 2020.
Why should we take the advice of our elected officials when the governor cannot follow them?
Well, you got the unelected officials like Olivia and myself, who have not been doing things inappropriately, with the exception of me making an inappropriate remark. But basically, we're there, and we've been put in this position to be able to do the job that we are tasked to do without prejudice and without not paying attention to science. So I think you can pay attention to the people like Olivia, who's our public health officer.
Okay, so what percentage of the population actually want the vaccine versus what is needed?
So about 40% to 50% want the vaccine now. There are three different categories of people who are not wanting the vaccine. One are the anti-vaxxers, which are a small number of people who are quite rabid about this, and we probably won't be able to address them. The second is minority communities that are resistant to some extent because they're afraid of what's been done in the past. We've got to do a lot of work with them using people that are appropriate for that population. And then the third population are those who have language difficulties, Hmong, Mandarin, Spanish, et cetera. We're going to have to do, again, a lot of outreach to them to make sure that they get into care. And these folks particularly are important to get vaccinated because they are the most at risk.
Okay, I'm a case investigator for Sacramento County Contact Tracing Program. I have seen a large number of cases from people returning from Las Vegas. Would we consider doing a mandatory quarantine for people who visit certain areas?
Well, now we do have the advisory where anyone returning to California should go on a quarantine. It is difficult to make it mandatory because it's difficult to enforce, especially for people who are, driving. But definitely we do have the advisory, and I know that there are some businesses that are able to enforce it with their employees. And we also know that many, in some of the colleges, they're actually telling their students that if the students do go for the Thanksgiving break, that they should not return until the new year.
Is Sacramento testing wastewater for COVID? And if so, how is this data being used?
I know that there was discussion of some testing being done. I've unfortunately not been able to keep up with it. We are not using that data right now, but I know that from discussions with our colleagues in waste management, that it seemed like a very promising tool that we could use to indicate when there's an increase in infections.
What are some ways in which there has been or can be further collaboration between K through 12 higher education institutions and public health officials?
I think, to be fair to the public health officials and the public school folks, Dave Gordon of SCOE, Sacramento County Office of Education, which is the head of all 13 jurisdictions in the county, has been extremely collaborative with Olivia and myself, Olivia particularly, and they've been working very, very closely together. And we've come up with guidelines that are really the guidelines that the county is using. We also work with the public and private K through 12 schools quite effectively, I would say, and actually we meet with them regularly as well. I don't know about the Sac States and the UC Davises of the world. We do work with as well.
Yes, we have been in regular communication with Sac State officials. We did review their protocols when they were considering reopening. And even as they were setting up their testing protocols, we reviewed them. So we do have very good communication.
Given that the Board of Supervisors just passed a resolution of racism as a public health crisis, how is racial equity incorporated in the COVID-19 response?
Yeah, that's a good question. And that was actually one of the criteria that the state is requiring us to address, both by monitoring the positivity rate to make sure that we have adequate testing in those communities that are disadvantaged. We are also required, as part of the funding that we are getting from the state, that we show how we are allocating resources to those communities to address the health inequities. And we are also encouraged to have dedicated staff. So we just recently hired a staff person that would focus on health equity issues. And so partnering with the community-based agencies and working with the disadvantaged communities so that we're able to understand better what their needs are and how to be able to assist them. And as I mentioned also, as when we got the CARES funding, a large percentage of that went towards community-based agencies to be able to assist people in the disadvantaged communities that were impacted by COVID-19.
Yeah, and we also particularly located our 10 centers, our testing centers, specifically in areas that were in need of equity. And we've, as Olivia said, we hire people from the Asian Pacific Islander groups, from La Familia, a lot of community-based organizations, specifically for these different communities.
Okay, I appreciate the opportunity to ask a question in this forum. However, the restrictions against any public meetings is a violation of our constitutional right to freedom of assembly. Furthermore, casinos are open 24 hours a day, 7 days a week, with indoor dining and smoking. Whereas I am unable to attend a 1-hour church service or a church service of any length indoors on our now cold, rainy days. If churches set up slot machines, would you have deigned to allow us to then safely worship?
Well, the answer is that churches were allowed to be open to 100 people or 25% of capacity while we were in red, and in purple they have to be outdoors. That's true, but the card rooms and the casinos should not be able to be open the way that you're discussing. And again, call 311 and we will go out and enforce them. They should not be able to do what they're doing.
Okay, do you know how expensive it is to rent tent and heaters? And to have a tent, you can only have one wall with 3 walls open. What is the point of a tent?
Yeah, we know that. I've been talking to the restaurateurs probably almost every week, and that we hear this frequently. I actually checked on it with Olivia, and then we did with the state as to whether you could do maybe two walls, 2 curtains, but they are adamant that it's going to only be one for it to be considered outdoors. So that's something that comes from the state.
And I also want to point out that when the guidance was put out for the tents, it did make more sense during the summertime, because what was most important was being able to have the shade and then allow for the free flow of air. But right now, I do agree that with the weather that we have right now, it does make it difficult to have just one wall. We do continue to put those concerns forward to the state in our weekly calls to let them know. And definitely we've heard it many times from the restaurant owners about the difficulty of being able to operate outside during the winter time. We have not been able to have any of the guidance changed as yet, but we will continue to bring those concerns forward.
Okay, what is the immunity period after one has had COVID?
We don't know that. We don't know that well. It's probably at least a few months, maybe longer, and maybe some people, maybe 70% of people get immunity, and maybe not. It's really not well known as of yet. Probably a decent number of people get at least some immunity, but we don't know that.
Okay, keeping the schools closed disadvantages the poor and at-risk children the most. Scientists and doctors widely agree that lockdowns hurt children more than reopening. How do you justify ignoring that science while accepting lockdowns that have very little differences in outcomes with populations that stayed open?
I do want to point out one thing is that I know that people keep talking about ignoring the science. There are a lot of factors that are taken into consideration when coming up with the guidance. I know it is difficult, and I know it's a difficult task because you're trying to look at the needs of entire communities and a wide variety of businesses. I also want to point out that I think what is important, and there is a lot of concern about the children, but I think it's important to also recognize that as adults, we set the pace for how children respond or react to these adverse circumstances. And we know in talking to educators that when the parents are able to provide that emotional and social support, that the children are actually more able to be more resilient through these adverse conditions. But when we are also, showing a lot of anxiety and emotions, I think it does impact the children in that they do tend to internalize it. So I think it's important for us to realize that we are able to help children to get through this. I know that schools have been working to try and provide that support as well. And of course, we're aware that distance learning, especially for children, is not ideal. But I think we should also realize that this is for a period of time. We will be able to get back to the point where we can have in-person learning, but we also want to do it safely. Because if we open the schools and then we end up having a lot of outbreaks, we'll just end up closing them again. So we need to be able to do it safely. so that, you know, we're able to protect both the children and the teachers.
Okay, if you test negative, is it correct that by the time you get home, you could become positive?
Yes.
Do we know how long the vaccine will last? And will we need a shot every year?
We don't know that yet. You know, we don't know that yet, do we, Olivia?
No, we don't.
So there's 2 shots right now that have come out. One is Moderna, which is apparently about 94.5% effective, at least in early studies. The other is Pfizer, which is 95 to 90% effective, both of which are, if true, are vastly more effective than with the flu. And so that'd be a really, really good thing. The problem is with those 2 vaccines, they each need 2 shots to be given. The first one, the Pfizer, is in super cold holding temperatures, and the Moderna one is in cold temperatures. The 2 other vaccines that are coming down the pike, I believe, just have 1 shot and don't have as much need for refrigeration. But I don't think we know how long they're going to last yet.
Okay, so why are the schools that are currently open not being closed down? Why do we have to wait for a possible exposure to close?
We are following the state guidelines, which state that if a school has opened and we revert back to purple, that they can remain open until, unless they can remain open unless they, we have an outbreak in the school.
Okay. What is the current guidance for religious gatherings?
They can only operate outdoors, and in Sacramento County, we put a limit of 100 people or 25% of the available space.
Are you doing contact tracing? If so, how are you reporting those results? Can you describe the conclusions you have reached using that data? For example, where are most transmissions occurring?
Yes, we are doing contact tracing. I want to point out that when we are asking about the questions to find out where a person could have been exposed, we are basically having to look back at a 2-week period. So oftentimes it is difficult to be able to track back in each situation. So there is a certain percentage where we will not know. And that's actually the definition of community spread. You're not able to determine where the person may have gotten the infection. But for those that we are able to make a determination, oftentimes gatherings, private gatherings are the majority of the cases.
Of all the current cases, how many are children under 9? How many are students attending in-person classes?
Few percent.
Have those numbers.
There's probably less than 5%. But before people go off saying that there's no danger to kids and that there's asymptomatic, et cetera, let me just make a few points. First of all, there is a lot of a more asymptomatic spread of the disease, asymptomatic being without symptoms, and people can become super spreaders without showing symptoms as teenagers themselves and spread it to their grandparents, their parents, et cetera, which can be quite dangerous. That's number one. Number two, a sizable percentage of people, between 10 and 30% of people over all age groups, suffer from long-term consequences of the COVID infection, whether or not they necessarily had a major case. And those 10 to 30% suffer from things like heart disease, clotting, blood clotting diseases, respiratory conditions, brain fog, fatigue, et cetera. And so 10 to 30% of those folks, of the 11 million people who have the virus, means we're talking 2.5, 3 million people who are severely affected by this virus, not counting the 260,000 that are killed. So before people say that And it is true that elementary school kids are less likely to get it, but there are other consequences as well.
Okay, and a follow-up to the question about religious gathering is, what are the guidelines for religious institutions that may be meeting in private homes?
Well, those are the private gatherings that we're asking people to avoid.
Okay, and a clarification, did you say that the positivity rate went from 7.4 per 100,000 to 21 per 100,000 within the
That's
last?
the case rate from 7 per 100,000 approximately to 21 per 100,000. The positivity rate, which is the percentage of positive tests that are done, has gone up recently from 2.7% to 6.4%.
Okay, we know that the transmission in grades K through 6 is low. Is there any new information on the number of cases where young students bring infection home to their parents and grandparents?
Yes, we have had those instances. They're not many, but they have occurred.
If we continue to open and close, does it not make sense that the virus will spike after each reopening and we are just prolonging the flattening? Therefore, why not just keep everything open with parameters?
Very good point. Parameters, I think it gets back to the point that I was making earlier, where if we could be very judicious in how we reopen slowly instead of opening the restaurants to full capacity, do it to 25% capacity as we had done. And again, pull back in the same way. So we kind of go gradually back and forth. I think what's happened is we've gone kind of radically back and forth. And so, yes, indeed, we have had, I think this is a fourth cycle now of breaking the curve, increase, breaking the curve, increase, and now breaking the curve and increase again. And I think there are ways probably to have limited the ups and downs if we had done it a little bit better. But again, a lot of this is in hindsight, and so I don't want to diminish the efforts of others.
Okay, we called 311 to report businesses, but is there a way to report people who are having large gatherings in their homes?
Yeah, you can call 311 as well. The problem with that is that they are not heavily staffed on the weekends when most of these parties are occurring, and so they can't go out there quickly enough. That's why it would be great if the sheriff could help with the enforcement of this, because they have thousands of people that are all over the county and could respond at any given time.
Do we have a count of the number of patients for Sacramento County and statewide, not the census at a point in time, but numbers of admits or discharges?
We do not have that. I know that definitely the hospitals do have that, but what we've been tracking is the hospitalizations for COVID-19.
Okay, so there's a little more context as to the impact of the effect of health orders on residents' overall health. The asker references the Great Barrington Declaration and cites that current lockdown policies are producing devastating effects on short and long-term public health. The results include lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screenings, and deteriorating mental health, leading to greater excess mortality in years to come, with the working class and younger members of society carrying the heaviest burden. Keeping students out of school is a grave injustice.
What's the question?
The question is why, so the question is, so I guess
Great Barrington.
With reference to the health officer orders and consideration for other unanticipated or perhaps other health effects beyond the immediate effects of COVID.
Yes, we do recognize that there are other consequences, but I think people need to remember that we're dealing with a crisis, we're dealing with a pandemic, And so we do need to get this under control. And I think knowing, of course, what the other impacts are, I think that should be a driver for all of us to work hard and work together to be able to bring these numbers down so that we can get to that point where we're able to open up more and be able to open our schools and keep them open. But I think it's important for us to realize just what a devastating impact this COVID-19 has had in families, in communities, and you know, it's one of our top causes of death right now, and we're not even past the year yet. So that should show us how significant this disease is and how seriously we need to take it. And yes, we are aware of some of those other health issues, and that is why it's also important that other healthcare providers do work with us to be able to mitigate and minimize some of those other impacts.
Who's making the decisions for our state regarding the color tiers and the mandates associated with those tiers?
The state works with a team of experts, and also they do have several members of the California Department of Public Health working together in developing the tiers.
But let's be clear here, because I think there's some misconception, and potentially earlier on we had maybe more to do with it, but we really, as the local health department, has very little to do with the actual implementation of purple and red and yellow and orange, and what the restrictions are. The state pretty much puts them on, and we kind of have to do it. We can influence things around the edges, but it's predominantly the state.
Okay, can our two experts help put an end to this quote unquote, let's try herd immunity nonsense? It seems to come up every other Tuesday.
Right. I mean, it does not seem to make sense. They have tried it in a couple of places and it's not done well. And again, especially with the vaccine coming down the pike now that we can actually see the light at the end of the tunnel, what we really need to do is just be very diligent to try and get past the pandemic fatigue, to really work hard to keep gatherings down to a minimum, and Thanksgiving and Christmas holidays, and try and get through the period of time and through the winter, and then start getting the vaccinations so we can put aside herd immunity will then be real. It'll be herd immunity by the vaccine.
Okay, and along those lines, do you anticipate that vaccines will be administered in doctors' offices?
Yes, our doctors' offices will be one of the sites that will be used for the vaccinations, but initially probably we will have it more in the hospitals and with public health. A lot will depend on how much we get and how quickly we are able to get to the point of having enough that we can readily make it available to the general public.
Okay, a question about sheltering in place. If we're going back to sheltering in place, how does that work for the unhoused around our city and county?
It does not work very well for the unhoused around our city and county. Our health order deals with people in encampments, protecting them in a wide variety of ways, not in all ways, but as long as they're on public property, not infringing on the sidewalks, and that they don't have outrageous amounts of trash, they're allowed to stay in the encampments. Encampments obviously are not the greatest place to be. We're working on trying to get more places for folks to be, whether they're tough sheds or little tiny houses or things like that. We have done a fair amount of getting 1,000 or more people into hotel rooms who actually did not have COVID, but were at risk for COVID because of their age and underlying conditions. So we've done a fair amount of getting homeless people off the streets, but it's clearly not one of the least safe things to do. Although I will say that we have, what, 75 cases? Something like that, Olivia?
I believe it's 90 now.
I mean, we have very few cases, considering how many homeless folks are living in Sacramento and how many are on the street. We would have thought we would have gotten more, but I think we got 90, and we've been testing a lot. So we've been trying to get people off the street and keep them in undercover, and that's been quite successful.
It's my understanding that the sheriff received significant CARES funding. I'm confused as to why they are not agreeing to help enforce the prohibition against large gatherings. What is the logic behind the sheriff's decision?
You have to ask him.
Much of Sacramento County citizens live in the incorporated cities. Even if the sheriff won't arrest or stop party goers in the unincorporated areas, have you worked with the 7 cities' police departments to do so in the cities?
Yes, and I should point out that many of the cities, or at least a few of the cities, there's 7 cities, a few of them contract out with the sheriff's department for their staff. So that's why we have not been able to do terribly much with those cities in the county. Sacramento Police Department is a bit more amenable, and we'll be working with them in terms of helping us to enforce the law, the order.
A few weeks ago, a caller at the Board of Supervisors stated that places like South Dakota never closed. Now we're seeing that South Dakota is one of the states that's being hit hardest. What can we continue to do to keep our residents in Sacramento County safe and not see the numbers like those in South Dakota and across the nation?
Well, we have a masking requirement, which is something that South Dakota did not have. I think South Dakota and a lot of those Midwestern states have been quite foolish. If you go all the way down, it goes down from South Dakota and Minnesota and Wisconsin down to Louisiana and Texas, are a huge number of cases in those areas right now. And so just masking, social distancing, all the smart things that we talk about all the time really make a difference. They really make a difference. And so people just need to do that.
If we only get 40% vaccinated, will the restrictions be lifted, or will they want 70% vaccinated before we can drop all the mitigation policies and restrictions?
Good question. I'm not sure. I would argue, though, that we're not going to be at, if we're not at full herd immunity with our vaccinations, then we're going to have more restrictions on than we otherwise would. If we want to get to a state of normalcy, we've got to get at least 70% of people immunized. And it's a very safe vaccine. It's being looked at by multiple jurisdictions, not just the federal government and the FDA. And people are really going to have to take this vaccine in order for it to make a difference. Otherwise, we're going to be fighting this virus for years and years to come.
Okay, several times you have mentioned that infections are occurring in nursing homes and at house parties, and not as many at elementary schools. Where are these statistics published so the public can look at them?
Olivia?
Yeah, some of that information is information that we get as we get more detailed data from our reports. With our dashboard, we limit the amount of information on there because we want to provide information that is readily visible and that people are able to interpret real quickly. Some of the details, such as where the infections are occurring, is not something that we examine on a weekly basis. It's usually a report that is given to us from time to time as the epidemiologists are working on the data. We have had some requests from time to time from different individuals that have requested that, and we've been able to provide it.
We might take a look at doing that on an ad hoc basis, Olivia. It's not a bad idea.
Sure.
Okay, in regards to the homeless in Sacramento, do they have access to testing, and are they being tested? Are we seeing a high number of homeless entering the hospitals with COVID symptoms, then testing positive?
You know, actually, the homeless population has been shielded for the most part. We do have a team of nurses that does regular testing in that population. When somebody is going to be housed, they get tested. They also, this team also goes to some of the encampments and offers testing to those individuals as well. We do not have a large number of homeless that have had to be hospitalized. My recollection, they're less than five that I'm aware of. And so I think that's a good thing that we've been able to protect and shield that population from the COVID-19 for the most part.
You're muted. You're muted.
You're muted.
All right, I'm back on, guys. There seems to be an overwhelming body of evidence that racism is a public health crisis. How is it humanly possible that we didn't have a unanimous vote in favor of a resolution acknowledging this?
Good question.
I think part of it also is that it's a recognition that we still need to do outreach and education in terms of people understanding what is a public health crisis and realizing that actually a lot of our public health crises occur over a long period of time. We've had a crisis with syphilis that we've been dealing with for several years. We've had a crisis with HIV and AIDS that we've been dealing with for several years. And so having a crisis basically means that you're recognizing that this is something that you need to pay attention to because it is impacting a large number of people. And then you set up a plan to be able to address it. The other also is what we find oftentimes is when you start talking about racism, a number of people think about only the interpersonal racism with the name calling or beating that could occur between one person or another. But there are also other forms of racism that people need to be aware of that could be more pervasive and more difficult to identify, but can impact communities, can impact individuals. And with that, for example, we're talking about the institutional racism, where you find a lot of policies, especially, that do impact individuals and, disparately, where you find certain communities that are impacted more than others. And also realizing what the impact of racism is. I know that we've been talking about adverse childhood experiences and the realization that these experiences do have an impact on someone's system and can actually result in poor health outcomes later on in life, such as poor birth outcomes, depression, drug abuse, and a whole host of other chronic diseases, diabetes, obesity, and so on, and hypertension. So realizing that how some of these can impact a person for the entirety of their life course is important. And also understanding how many of these policies are impacting communities. And so that would take being able to be able to bring the data together to help with telling the story, and then also being able to identify some of those policies and addressing them.
But I think that in answer to the specific question, the inequities are so obvious that I don't understand how people could not vote for it.
All right. So assuming we can begin to administer the vaccine in the next few months and this requires 2 injections. How will we be able to assure people get the second injection? What kind of follow-up can be built in to assure people get both shots to be fully immunized?
We already have a system in place, actually several, with healthcare providers. If the vaccination is going to be done through healthcare providers, many of them have electronic medical record systems that would be able to help them to identify who has been vaccinated and when they're due for their next vaccination. We also have our state system that helps us to track who's been vaccinated and when they're due for their second vaccination. So I think that being able to make sure that we can use those systems will be important. And again, I think what's important, and the other thing actually is even being able to give people a card for children when they're getting their vaccinations. We give them a yellow card. We can also provide that to individuals so that they are able to remember when they're due for their second shot.
Okay, the dashboard states there are 559 additional cases and 8 additional deaths. What does this mean?
Oh, there are 559 new cases in this one day, and there are 8 new deaths in this one day. So we're actually up around 35 cases per 100,000, if that's a correct number.
I think the last time I checked, it was 27 per 100.
Really?
Yeah.
500 or so is going to be more like 35.
Right. Well, the numbers do go up and down because on some days we do get like over 500, and then
Right.
the next day it's 300. So it's averaging about 300 to 400 on a daily basis. So yeah.
Okay, I have a follow-up to the question about the unhoused and the homeless population. How is it that the homeless population has been shielded from COVID?
So I think that actually it's related to in some large part, they're outdoors. They're predominantly outdoors. They are spaced. They're actually spaced out. They're not necessarily wearing masks, but being outdoors makes a huge difference. It's been proven many times that compared to indoors, particularly in small areas indoors, it's much safer to be outdoors. So I would venture to guess it's related to the outdoors.
When you're citing testing statistics, how do you account for one person taking multiple tests?
When we are looking at the test, because we of course we have the information, a name and date of birth and identifying information, we only count it once. Even if somebody goes, from one place to another and gets the test, we only count it once.
If businesses can only operate at 25% capacity, are you reducing their business fees and taxes to 25% of their norm?
Good question. We are not as a public health people, but I would certainly talk to your city or county representatives to push for the tax waivers or whatever.
How much more effective for immunity is a vaccine versus actually having the virus?
As far as we can tell, in this case, at least it's the vaccine, because the vaccine is 90 to 95% effective, at least in what it looks like right now. And the antibody rate has been about 70% maybe of those who have been infected in the past. And we don't know how long that immunity lasts. So I think in this case, it's going to be the vaccine.
I also want to point out that getting the disease carries with it a lot of risks, as Dr. Beilenson had pointed out, risks of complications, risks of symptoms that go on for a long time, so the so-called long haulers, and also carries the risk of death. Whereas with the vaccine, those risks are, minimal.
Good point.
Okay, would it be safe to travel and camp in a remote area at this time?
If you're going to stay within your family unit, it should be fine.
Yep.
Okay, so how many people working cash registers at a grocery store are getting infected? Does it shed out like this?
We do not have those numbers. Sometimes it's difficult to get to that level of detail. What I can say is that we have not seen large outbreaks at that are related to some of these retails.
How do you explain the data showing other much less restrictive states reflecting same peaks and valleys in regards to COVID spikes as California? It would appear lockdowns make no difference.
I disagree. I think if you look at the states right now that are having problems, as well as states like Georgia, Florida that had problems back a few months ago, that those that are less restrictive have been at least as severe in terms of their spread of the disease, if not vastly more severe.
I also want to point out that people do travel. And when we've been doing our contact tracing, oftentimes we've found that the person who introduced the COVID-19 had traveled to another state that had high rates.
Good point.
Okay, why are restaurants being targeted if only 7% of cases can be attributed to that industry? It seems like a very small piece of the pie.
We agree, which is why we've been pushing the state to try and change that.
Wouldn't new elementary schools still be able to open via a waiver as provided for by the state?
That's correct, yes.
Okay, youth sports and high school sports are a big deal to a lot of people, particularly to high school students as it relates to mental health and physical health. Considering that people under 18 are not generally spreaders of the virus, have you considered the Wisconsin study in making evidence-based decision related to allowing youth to play their sports in Sacramento County?
I'm not sure what that Wisconsin study is, but what I can say is that we have had cases among some of the teams. So we cannot say that youth do not spread the disease. We do know from our numbers that the disease numbers in this age group less than 18 are less, but it's not zero.
Okay, forgive me if I asked this one already, but we know that transmission in grades K through 6 is low. Is there any new information on the number of cases where young students bring infection home to their parents and grandparents?
Yes, we've had a few of those in the cases that we have.
Two more questions.
Two more questions. There has been a worldwide spike in measles. How is this related to the pandemic? Tracking immunizations through schools by school nurses?
I'm not aware of the measles outbreak. You certainly can track them through school nurses, but we do that through our local health department as well. And the measles vaccinations cover, I mean, everybody's required to have measles vaccinations. There's a huge percentage of people that have the measles vaccine.
Yeah, measles is reportable to public health. So if there was a measles outbreak, we would have known about it.
Okay, this last question will just be a two-parter. Everything you're talking about with ACEs, mental health, trauma, etc., is exactly why you need to let kids play sports. How do they manage stress when you keep taking the outlets and social norming away?
So,
We do understand that. Go ahead.
No, go ahead, Olivia.
I was just going to say that we do understand that, yes, this does create stress, but I think we are in Sacramento allowing for youth conditioning. So they do have a way of being able to release some of that. And I think, again, as parents, being able to provide that support to help the youth get through this is important.
And the second thing I would mention is that the vaccine is coming. The vaccine is coming. We should be back to normalcy by the summertime or late summer. And in terms of the kids playing sports, I would argue that there probably should be a kind of a dichotomy between those which are contact sports like basketball, soccer, football, where you're on top of each other, as opposed to, let's say, baseball or tennis or track or something like that, which we were a little bit more open with before we were on purple.
Okay, well, I wanted to extend a thank you to Dr. Olivia Kasirye and Dr. Peter Beilenson, as well as our interpreters and translators. And thank you to the public for joining us tonight. See you next time.
Bye.
Thank you.